today our Dr. Smiley Joshi, physician and chest specialist, we are going to discuss about hypertension. In our today's discussion, we will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy and normal blood pressures, but what exactly does this mean? Basically, each time when our heart pumps, beat, it pumps blood into the blood vessels. This creates a pressures along the blood vessels walls. This is called as a blood pressure, which is an essential because of which the blood is able to go to all the blood is able to pump throughout the circulation. Normally, in healthy persons, the blood pressure rises and fall throughout the day. Because of whenever we do some physical activity, the blood pressure increases. When we are at rest, the blood pressure decreases. But if there is a persistent increase in blood pressure throughout the day, it will lead to this could lead to hypertension. Normally, in healthy person, it rises and falls throughout the day. But when blood pressure remains high throughout the day, this is called as a hypertension, which has got a lot of complications. In general, persistent increase in blood pressures higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyles, obesity, sedentary lifestyles, smoking, alcohol intake, multiple drug abusers, and stress, increase in sympathetic stimulations. There are also other risk factors that can also can lead to hypertension. In addition to these, with age, as the people get older, the arteries they got stiffened. There is calcifications in the artery which can lead to hypertension. Family history of high blood pressures, one or more close family members with hypertension increases person's risk of developing the hypertension. Excess salt intake is can lead to increase in the blood pressure. Because of the increased salt intake, there is increase in the water retention in the blood vessels, which can lead to the high blood pressures. Not in eating enough foods with potassium can also lead to high blood pressures, and is also with increasing blood pressures, there is increased risk of stroke, CVA, myocardial infarction, and there is increased risk of chronic kidney disease. Eating processed and fatty foods, increased fat intake throughout the body may make the heart have to work, pump, the heart has to pump more, hence causing blood pressures to rise. On the other hand, lack of the physical activity is also linked, and also obesity can further lead to high blood pressures. Another most important risk factor for this hypertension in today's world is stress. Increased stress leads to increased cortisol productions and unhealthy lifestyles, more working hours, less time for the rest. These all can lead to increase in the blood pressures. Moving on, hypertension does not have any obvious signs and symptoms. It's very commonly called as that hypertension is a silent killer, because the hypertension, except for in few cases in which there is an occipital headache or there is a band-like sensation in the head, usually the hypertension doesn't have any symptoms. The patient himself or herself doesn't know that he is having a blood pressures. And these blood pressure, what they causes, this causes increase in the there is increase in the cholesterol depositions in the arteries, which can lead to increase the risk of MI and the CVA and the stroke. Hence, early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure is the only way to whether the person is having hypertension or not. Not only on single reading, for multiple times the patient have to get his blood pressure checked. Generally, when symptoms do occur, they include morning headaches, tiredness, vision change, buzzing in the ears, fatigue, nausea, vomiting. If the person is experiencing some of these symptoms, then one should get their blood pressure checked immediately. Fortunately, high blood pressures can be easily diagnosed. It is usually measured with an instrument called as a sphygmomanometer. A blood pressure is recorded in two numbers. One is a systolic, one is a diastolic blood pressure. Now let's try to understand what these systolic and diastolic blood pressures means. A healthy or normal blood pressures in a young adult should be lower than 120 to 80, as it can be read as a 120 over 80 mm. Hence, the upper number indicates the systolic blood pressures, the lower number indicates the diastolic blood pressures. The systolic blood pressures means the pressures in the blood vessels when the heart contracts, whereas the diastolic blood pressures means the pressure in the blood vessels when the heart relaxes. If blood pressure level is more than 140 by 90 mm, then the person is having hypertension. If the person have BP levels higher than this, then he or she might or have a risk of developing serious heart diseases. On 17th May, we celebrate the World Hypertension Day, which is a day dedicated to highlighting the importance of monitoring regular blood pressures and bringing global awareness to around 1 billion people living with high blood pressures worldwide. The theme of this year's World Hypertension Day is Measure Your Blood Pressures, Control It, and Live Longer. Ensure that your BP is measured and controlled if it is elevated. The risk can be prevented by reducing the taking steps towards a healthy lifestyle. Regular exercise, decrease salt intake, less stress level, having at least 7 to 8 hours of sound sleep, quit smoking and alcohol, stress management, and in case the patient had already developed hypertension, then adherence or compliance to the medication is the must. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid, delay, or decrease the dose of antihypertensive. So let's take a look of these strategies one by one. The regular exercise or the physical activity, it has been with American Heart Association, it has been told with every 20 to 30 minutes of daily walk, the risk of mortality because of the CVA because of myocardial infarction decreases significantly. In other case, as we are all aware that age and weight gain are the two major risk factors for the high BP. So if the blood pressure is at a described level that is less than 120 by 80 mm, then exercise can help to and prevent it from rising as we grow older. Regular exercise also helps you to maintain a healthy weight, which in my opinion is an important way to control blood pressures. One should aim for at least 30 minutes of aerobic exercise daily for at least 4 to 5 days a week. High BP level can be reduced by doing regular exercises such as brisk walking, swimming, cycling. Healthy diet. Uh, because of the busy schedule, we all know that we are more prone to we are using more of the diets from the outside. The regular diet, homemade food, eating less of the outside food, and getting plenty of potassium, more of the fruits and vegetables in our diet, and limiting the amount of alcohol and sodium is an important key factor for maintaining a healthy diet. We have means DASH means dietary approach to stop hypertension. Eating a DASH diet that is rich in whole grains, fruits, vegetables, low fat dairy products, and skims on saturated food and cholesterol can lower one's blood pressure to around 11 mm if having high blood pressures. Reducing salt intake to at least reducing the salt intake can decrease the blood pressure to by 5 to 6 mm. We should read the food label whenever we are consuming everything. We should try to use low sodium alternatives, eat fewer processed food. Only a small amount of the sodium occurs naturally in the food. More sodium is added during processing, so we should avoid the processed foods. Don't add salt extra. Just one level of teaspoons of salt has 2300 mg of sodium. Avoid adding salt to the food. Use herbs or spices to add flavor to our food. The smoking. As we have already known that the smoking is a major risk factor for hypertension as well as for myocardial infarction. A smoker is having 100 times more risk of having myocardial infarctions or CVA as compared to a normal person. Regular blood pressure monitoring is a must so that we are able to know that we are on higher side or not. Stress management by either regular exercising, listening to music, focusing on calm and peaceful environment, meditation. And in last, if we have already developed blood pressures, then the compliance to the medication is a must so that our aim should be blood pressure of 140 or 90 and less. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyles can help us to enjoy long and healthy life. High blood pressures can be prevented as well as controlled in many ways. Keeping blood pressures in the normal way is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressures level with regular monitoring and preventive care. I think that's all for about the hypertension. With this, we can close our session.